Thanks very much for the invite. As you know, I'm retired now, so when you retire, you spend a lot of time reflecting. It's a great time for reflection and looking back. So this talk today is a little bit about that reflection and looking back. Sometimes I feel like I'm in a play and I keep bumping into some of the actors in the play. I see them here in the audience. Great to see you. And it's been great to be part of the play. So, as I was saying, I think this talk in many ways is a bit of a personal journey. It's a reflection of maybe about 40 years working in the field, initially in Ireland, then United States. I'm not going to talk about that, but really when I came back to Ireland in 1991. But I think it's not just a reflection of that and that journey, but I think really it's about something a lot bigger, and really what I want to talk about today is how we can imagine a better future for people living with dementia. So I'm not sure whether people recognize this great Caribbean philosopher. I think this is an unexpected quotation from a fictional character, Captain Jack Sparrow from the Pirates of the Caribbean. He may have lived in the 1720s. I'm going to talk a little bit about that in a moment, but it's really about the importance of attitude. And this is what he said. He said, the problem is not the problem is your attitude about the problem. And if there's one point I'd like to make today to you, it's that I think the biggest barrier to dementia is not that we don't have a cure for it, although clearly that would be a huge advantage. It would make a big difference, and it will make a big difference. But the problem really has been and continues to be our attitude to dementia. So, like Jack Sparrow said, it's really how we think and see about people with dementia, because stigma has shaped how we diagnose, how we treat, how we care for people living with dementia, and ultimately how people live with the condition. And if stigma is the problem, what I'd like to talk to you about today is, and argue that the most important and powerful antidote could be hope and imagination. So here's a little thought exercise. Retirement is about reflection, going back. Let's imagine dementia over 3 different time periods. 300 years ago, and I picked the year 1726 for a reason. Then let's go back about 40 years ago, or it's probably more like 46 years ago now. And then let's think about today. So let's ask ourselves, what's changed? What stayed the same? And where's the potential for the future when talking about dementia? So 1726, 300 years ago, Gulliver's Travels is 300 years old this year, believe it or not. Written by Jonathan Swift. But really, in this book, Gulliver meets the Struldbrugs in the island of Ludnag. He was excited to meet these people because they were immortals, and he was excited about meeting people who could live forever. But unfortunately, he was very disappointed because he then learned that these people actually had all the diseases of aging, including dementia. And I think Swift brilliantly describes in the early literature what it was like to experience the episodic memory deficits of Alzheimer's disease. Now, these people were easily recognized. Over their left eyebrow, they had a dot, the mark of stigma. They were considered dead in law, legally dead. So here, Swift, in this fantasy satirical novel, was highlighting society's many injustices, how older people, and particularly those with dementia, were stigmatized and excluded. And this was 300 years ago. Ironically, Swift himself developed dementia, and he must have been aware. He must have been aware because he foretold his development of this illness almost a decade before he actually developed it. In the verses here, verses written on the death of Dean Swift. But he also talked about his plans to establish a psychiatric hospital that would care for people who were stigmatized, living with mental illness in a more humane way. And he left money in his will to set up or to establish a hospital for the Fools of Mad of Dublin, St. Patrick's Hospital, which opened in 1759 and hasn't closed its doors since. Swift was largely cut off from his life by his deafness and by his dementia from the late 1730s. He was declared of unsound mind in 1742, and during the last years of his life, he was cared for by his cousin, Martha Whiteway. So 300 years ago, this year, in 1726, as Swift described, Gulliver's experience was that people living with dementia were outcasts of society. They were feared because of the economic burden that they might place on our society. Does any of this sound familiar? Well, I think what's striking is not how strange all of this feels, but how familiar it still sounds, although it happened almost 300 years ago. So let's fast forward to St. Patrick's or Swift's Hospital in 1981. In 1980, I graduated from medical school. I began working, foolishly perhaps, in St. Patrick's Hospital in 1981, straight after my internship at Swift's Hospital, as a registrar in psychiatry. At that time, it struck me that despite the passage of almost 250 years, many of the underlying attitudes to dementia hadn't really changed that much. At that time, dementia was still called senility. It was poorly understood, rarely spoken about. People were hidden at home, warehoused in institutions, asylum, excluded from mainstream care. There was little advocacy, almost no research, and very limited services for people living with dementia. There's a gap, about 10 years, continued in clinical training, went to the United States, and came back in 1991. So, what was it like then? I returned as a consultant in old age psychiatry to St. Patrick's Hospital here and to St. James's Hospital. I was the second old age psychiatrist to be appointed in Ireland at the time. And my recollection is at that time, people living with dementia were recognized, referred, and diagnosed very late, often only when they had behavioral and psychological symptoms. The average duration of illness before presentation could be anything from 5 to 6 to 7 years. And I remember there was a lot of resistance to investigations due to the stigma of aging and dementia. And the dominant attitude, even among professionals in the hospitals at the time, was, what's the point in diagnosing dementia? There's really nothing. There's nothing we can do. Stigma was still very prevalent and pervasive. The services that existed and that were being developed were housed in old buildings and dimly lit wards. Here on the left, you can see where we actually established the first memory clinic in this prefab. It's still there. Then we were upgraded. We moved to the Hospital 4 at the old Victorian building. So that's what it was like at the time. In 1991, I think stigma was very much alive and well and living in Ireland. But stigma is more than just a word. Stigma has real impacts. It has real effect. It can be internalized. It causes people to become lonely, isolated, withdrawn, not to seek help. It can be very much associated. So if you're a caregiver, a person living, helping, caring for a person living with dementia, that stigma can be associated. Also, working in the field, in psychiatry, working with dementia, you can feel this associated dementia, associated stigma. And there is significant professional stigma, which can delay diagnosis and assessment. So Stigma is not just a word. It has very serious effects. It's not silent, it's not inactive. It does affect how we think, how we make decisions, how we prioritize care. And it did affect this back then. And a very, very good example of how stigma has an impact, how it has an effect, came to light when we carried out a study in the memory clinic back, it's over 30 years ago now. This was a study carried out by a registrar at the time, Conor Maguire, who decided he would look and see, well, what was the attitudes of family members to disclosing the diagnosis of Alzheimer's disease, family members to the person with dementia. And it came as a surprise to us at the time that at least 50% of family members didn't want their relative to know that they had dementia, that they had Alzheimer's disease. And why? Well, they were very much afraid, they were fearful that the person would react negatively, that they might become depressed. And of course, this is very, very similar to what we would have seen with cancer diagnosis back in the late 60s. Don't tell them, don't tell anybody. They won't be able to handle it. Now that has changed very significantly for cancer over the last 50 years, of course. Part of that is because of the advent of treatments, but there are many cancers that are not treatable. People still die of cancer. It has changed for dementia as well over the last 30 years, and I'll talk a little bit about that now. So looking at how attitudes have changed over the last 2 decades, I think it's been driven by a number of different factors. And it was just wonderful to be here this morning to hear Rita Komuski talk about her experience, because I think advocacy has really been to the forefront of changing attitudes, this public patient voice. We didn't see that back in the 1980s, or certainly in the 1990s. I think training and education has been a huge part of changing attitudes. Service development, and there have been very, very significant service developments. And of course, research, and we've heard a lot about research already today, and I think it's great to be here and looking at this North-South meeting and seeing the incredible, wonderful work that's happening right now. So again, these are the milestones that I've laid out. I'm sure I've left important milestones out, but I think the Alzheimer's Society of Ireland setting up in 1982, driven by caregivers at the time, I think that was a very important milestone. And the development of the Irish Dementia Working Group in 2013. This is where we're hearing more of the patient public voice, like we heard this morning. Significant investment by the HSE, or the health boards, as they were called back in the day. And there have been major developments in the area of old age psychiatry and medicine for the elderly, and I think this is welcome and it has made a difference, and it continues to develop. The DSIDC, 1998, I really do believe that was a very important milestone. And of course, the investments from Atlantic Philanthropies down from 2000, I think they have really accelerated the changes in attitude. The National Dementia Strategy happening in 2015, the Understand Together campaign, the HSE, ASI, Atlantic Philanthropies supported, and the Dementia Research Network Ireland, previously known as DRNI, but now the DRNI, and it's growing in strength. It's wonderful to see it. So these are some of the, I think, key milestones, I think, that helped in terms of changing the attitude to dementia. But I think what's key is the importance of people living with dementia as champions, like what we saw today. And I'd like to talk a little bit about the power of the individual, as we saw this morning, but also the power of community. One of the people, individuals, I think, who really made a huge difference in shifting the perspective and how we see people living with dementia was Terry Pratchett. Now, Terry Pratchett, was this famous fantasy writer, who developed posterior cortical atrophy, this rare form of Alzheimer's disease that we heard about this morning. And he was an extraordinary champion. He campaigned against the stigma of dementia. He talked about how we really keep it secret, hold it to ourselves. We're afraid to talk about it, like cancer. We're terrified of it. And interestingly, when he developed dementia and the diagnosis of dementia was made, he was talking to his assistant, Rob Wilkins, and Rob said to him, well, who should we tell? Thinking, well, we probably shouldn't tell a whole lot of people about this. Let's kind of keep it local. And Pratchett said, who do we tell? Let's tell everyone. It's an extraordinary thing to do back then. Let's tell everybody in the early 2000s. I also want to talk about the Understand Together campaign, and I think this was really very, very important because it was very much a community initiative funded through Atlantic Philanthropies, the Alzheimer's Society of Ireland, and the HSE. And really, what this campaign tried to do was to, again, tackle stigma, to end the fear and secrecy around dementia in Ireland. And it used creative ways, storytelling, trying to get the stories of people living with dementia out to the public to help people understand that we could create a more inclusive society for people living with dementia. It wanted to promote awareness. It wanted to get those public health messages out about the fact that you can live well with dementia, but it also wanted to create a sense of hope. And here you see some of the real-life stories that were created through this campaign. Real people talking about real lives and how it was possible to live well in spite of the difficulties and the challenges. And again, we heard that wonderful story this morning about how it is possible to do this when you feel included, when you are seen, when you are supported. For me, I think the most important part of Understand Together was the co-creation and the co-production. And this is where this campaign, I think, starred, because it was co-produced and co-created by people living with dementia. They told the stories. They directed the scenes. They told us how it should be done. So it is very real. And these were stories of what people can do, not what they couldn't do, how they could act, how they could be engaged, how they could be included. And they were very much stories of hope. I'd like to talk a little bit about Ronan Smith. You know, Ronan was an actor, director, producer, a writer, but he was, above all, a dementia advocate. And he was chair of the Irish Dementia Working Group at the time of Understand Together. And his contribution was critical, and the contributions of people living with dementia, their voice, ending the secrecy, was critical, I think, to the success of the campaign. And it was successful, and it was effective. And I think this was one of his statements actually made, I think back around 2015. He said, I have decided to hope because hope is a reasonable position. So over the past 20 years, I think what we have seen is a major attitudinal shift. And I think that's one of the big things that has happened. Attitude, the attitudinal shift, how we see people living with dementia. That has definitely changed over the last 20 years. We have moved from secrecy and silence to more voice, hearing the people living with dementia. And people living with dementia have become very strong advocates. And I love the phrase, nothing about us without us. I think certainly research, practice, what we do is now informed, influenced, quite rightly, by what people living with dementia think is the right thing to do. And I think we've reaped the benefits of this, and we've seen from the data and the evidence that there is an improving attitude to dementia. So in 2021, understand together. They repeated the surveys from 2016 to 2021, just to look and see, have attitudes changed related to the campaign and over time? And attitudes has changed. There had been a positive shift in public attitudes, the belief that, we are more inclusive, there's more empathy to people living with dementia. The figures show that there was an improvement from 2016 to 2021. So things were getting better, they were on the right track. Also, going back to that study in 1996 from Conor Maguire, Michelle O'Brien repeated the study in the memory clinic in 2021, 30 years later, and lo and behold, different attitude completely in terms of family members. Family members now said, of course we should tell them. It's the right thing to do. And what was most interesting was that the fear factor had changed. There was a very significant decrease in family members listing the idea that if I told them that they have dementia, that they have Alzheimer's disease, they'll get depressed or they'll be frightened by it. They'll have a negative reaction. That seemed to have changed as well. So attitude to disclosure, empathy towards people living with dementia, that does seem to have changed over the last 20 years. So that's one shift in attitude. But there's been another shift, which I think on this journey from dementia to brain health, and that is where we now see dementia, not just purely from a biological, medical disease model. There's been a shift to the concept of brain health. We know that there's a long preclinical phase, that this is an opportunity for prevention, that there are risk and protective factors. We heard about that this morning from Tilda, from Nicola. The potential for prevention, the potential for hope. As Ronan Smith said, it's a reasonable position to take, isn't it? But a brain health approach is not just about reducing risk. And I think there are challenges ahead, because we can talk about reducing risk. We know what to do now. But knowing what to do is different to doing what you know. That's the tricky part. How do we get society to change that attitude, to do what it knows? But a brain health approach is also about restoring agency, preserving dignity, creating hope. So the big pivot has been rethinking and reframing dementia as brain health. I think this is really important because it does change the story. It's a way that we can reduce stigma. It emphasizes we can do something about this. It gives the person a sense of agency, a sense of control. There are things you can do. It gives a person a sense of hope to counter the fear and stigma of dementia. So this is an important pivot. It shifts us from what I used to hear back in 1990. Why are you getting a scan on this person aged 74 with dementia? There's nothing you can do. 2, there is something we can do. There is always something we can do. I like to think in practical terms and in clinical practice. And if you take a brain health approach, if you rethink dementia as brain health, look at what can be done. Risk factor reduction. And there seems to be a lot of risk factors out there. Cardiometabolic, particularly. There's a lot that we can do in terms of risk factor reduction. Falls prevention, delirium prevention, taking people off inappropriate medications that are impairing their memory, social connection. We can prescribe this for people living with dementia if you take a brain health approach. And this is not just theoretical. I'm reminded of Adam Dyer and Sean Kennelly just published a paper looking at the NILVAD data and finding that people in that study who had episodes of delirium, they were much more likely to deteriorate over time compared to if you had no episodes of delirium. What an opportunity for intervention. And not only did delirium accelerate decline, but it accelerated decline very significantly in terms of our clinical dementia rating sum of boxes. What a huge opportunity for change, for intervention, for hope. So I think a shift in attitude in terms of the public patient voice, hearing the person living with dementia, the idea of brain health, this is a complete shift over the last 20 or 30 years. It's a positive shift in our mindset, in our attitude. It gives people agency, control. There are pathways now. There are things we can do. It's not just saying we've got to do something. There are things we can do. We can set goals, and critically, I think, we can give people more hope. This is an unprecedented time, really, in dementia, and particularly in the area of the biology of Alzheimer's disease. And there are going to be incredible opportunities, and there are incredible developments happening. We hear about the research this morning, but there are major advances happening in the area of biology. But when you think about risk factor prevention, there could be an unintended consequence of our advance in knowledge. We just have to be careful that people don't feel that they have to blame themselves if they can't prevent dementia. If they do all the right things and they get Alzheimer's disease or get dementia, the feeling that I didn't do enough to protect my brain. Because that's not a true, that's a false narrative. We just want to make sure that people don't feel that they're being blamed. Also, the advances in biomarkers and earlier diagnosis is phenomenal. There is an issue of false positives. There can be unnecessary distress. People can be labeled. It can cause inappropriate anxiety. So we have to be careful that we always put the patient at the center, thinking about the advances, how we can use them, but also make sure that people don't become stigmatized. I really do believe over the next 5-10 years there will be significant advances and availability of treatment. However, there could be issues of access, affordability. Again, we have to try and make sure that we don't inadvertently, through these advances, increase stigma. We want to make sure that people can access, that these treatments are available to everyone. Because so much of what goes wrong in dementia is due to stigma, but also it's socially determined. So I would say over the last 40 years, we have shifted, we have moved in the right direction. We've moved from silence to voice. I think we've moved away from fear to a better understanding, better awareness. I think we've moved from a medical disease model to a brain health model, which I think offers more hope. We have great opportunities for scientific discovery right now, but I think stigma is still with us. 2024, Lancet Neurology, dementia-related stigma is still pervasive. It is. We should never underestimate stigma. It's like a limpet. It keeps hanging in there. It's very hard to shake it out of your hair. That brings me to hope again. I think we should never underestimate the power of hope. Hope is fear turned inside out. We have to push hope as much as we can. And hope happens when we see what people with dementia can achieve if they're given half a chance. Every day, it's possible to see that. When you give a person living with dementia an opportunity, you see what they can do, not what they can't do. So, on the journey from dementia to brain health, what's the next stage? What's the next stage for early career researchers here, for all of us, as we look towards the future? I think we're going to see an amazing period now of advancing science discovery and research. Improvement in diagnosis, care, and treatment, I think, and DRNI, I think, is going to be at the center of that. here in Ireland. I think there are a lot of positives out there in terms of changing attitudes and rethinking, reframing dementia as brain health. But I would just add a note of caution, having been through this for the last 40 years. The problem is not just the problem. It's not just about finding a cure. It's not just about prevention. It's our attitude to the problem. Because no matter what, people will still live with dementia. So our attitude to the problem is really, really important. I'll leave the last word, this is not my last word, the last word, I'll leave this to Terry Pratchett. What I do share with the hundreds of thousands living with this tricksy condition is disbelief at the stigma and shame still surrounding a disease that affects the brain and which can ultimately affect as many as 1 in 3 of us. It's hard to shake it out of our hair. Stigma. We have to deal with it. So thank you very much.